Chromophobe renal cell carcinoma is a distinct subtype of kidney cancer, accounting for about 5% of all renal cell carcinomas. It originates from the intercalated cells of the collecting ducts and is known for its unique genetic profile, especially extreme hypodiploidy caused by multiple chromosome losses. Clinically, it usually affects patients in their 60s or 70s and is seen more commonly in males, with a 2-to-1 male predominance. Most cases are discovered incidentally during imaging studies performed for unrelated reasons, which is why it's often called a silent tumor. The classic triad of renal cell carcinoma, flank pain, palpable mass, and hematuria is actually rare, occurring together in only about 10% of patients. One of the most important exam points is prognosis. Compared to clear cell and papillary renal cell carcinoma, Chromophobe RCC generally follows a more indolent course and carries an excellent prognosis. For diagnosis, the initial investigation of choice is a CT scan or MRI. However, the gold standard remains histopathology with cytogenetic correlation. On microscopy, the most characteristic feature is the presence of a perinuclear halo. The tumor cells are large with prominent cell membranes, giving them a vegetable cell appearance. These cells usually contain pale eosinophilic cytoplasm and are arranged in solid sheets. A common exam trap is confusion with oncocytoma. Both tumors arise from intercalated cells and can appear eosinophilic, making differentiation important. Another favorite exam concept is prognosis ranking among renal cell carcinomas. In terms of survival, Chromophobe RCC has the best prognosis, followed by papillary RCC and then clear cell RCC. Unlike clear cell RCC, Chromophobe RCC is not typically associated with VHL gene mutations or chromosome 3p deletions. A useful mnemonic is Chrome Halo. Chrome stands for chromophobe. Halo reminds you of the characteristic perinuclear halo, and hypo refers to hypodiploidy due to multiple chromosome losses. For image-based questions, remember the classic vegetable cell appearance, thick cell membranes, and prominent perinuclear halos. In a typical exam vignette, if a 55-year-old male presents with an incidental renal mass and biopsy shows multiple chromosome losses along with perinuclear halos, the diagnosis is chromophobe renal cell carcinoma. The tumor originates from the intercalated cells of the collecting duct, and treatment usually involves radical nephrectomy or nephron-sparing surgery, especially if the lesion is smaller than 4 centimeters. Finally, patients can generally be reassured because Chromophobe RCC carries a significantly better prognosis than most other renal cancers.